Thanks, Chad. Heroin use is becoming more common in Lafayette, and so are heroin overdoses.
News 18's Elizabeth Rentschler has more on how many overdoses doctors see each week and why they expect the problem will only continue to get worse.
It's a site emergency room doctors at IU Health Arnett Hospital experience multiple times a week.
The patient comes in completely blue in the face, barely breathing.
Patients coming in after overdosing on heroin. Dr. Michael Tricoci says they'll see an average of about 5 patients a week who have overdosed on the deadly drug.
As a street drug, these people don't know the dose they're getting, so it can be changed by the dealer and result in a very quick onset of respiratory depression.
Before those patients even make it to the emergency room, they're greeted by the first responders. Tippecanoe County EMS Director Daryl Clace says in his 20-year career, he's seen heroin overdoses continue to soar.
The heroin and some of the opioid-based drugs are very easily attainable, and unfortunately, it boils down to personal choice for a lot of individuals.
Clay says in 2013, emergency responders administered Narcan, a drug that can reverse the side effects of a heroin overdose, about 140 times. He says this year, statistics show we're already on track to surpass that number.
According to our records, we've administered Narcan in the pre-hospital setting 86 times since January 1 of this year to today.
He says, unfortunately, Narcan has been administered to some patients on more than one occasion. Clay says while they can't stop the heroin epidemic in Lafayette, all they can hope for is that one day they'll save and even change a life for the better.
Who knows? One of these days we might have a positive effect and say the right thing to the person, and it's that third, fourth, fifth time, whatever, maybe actually make a difference in that person's life.
In Tippecanoe County, Elizabeth Rentschler,